What I feel is the most important thing for us to understand is how to free the information from systems and how to create the information from all the data we are producing. So in a way, my message today were that think about this as an infrastructure instead of different systems that should be interconnected or interoperable and so on. I'm amazed after today's all the lecture I've been hearing to see that we seems to have the same problems both in the UK and in Sweden. So in my mind it even tells me more that healthcare is something that is all over the world. It's hard to see the difference between the Swedish and the UK system after just one day learning what you are doing here. But what my experience from Sweden is, and it seems to be similar here, is that the patients are starting to be more mobile. We are getting more choices. We are giving more freedom to the patient, and we try to empower him to do more things. And that is naturally in conflict with the control. Somebody needs to have the control. And it's hard for us in Sweden to perhaps invite the private healthcare more deeply into our way of organizations and so on. So it's a political will that we should be more one taking care of the patient, but it takes a time for us as an organization to make those changes. And I must say, after working with the Västergötland region now since 2002, I must admit that things takes time in healthcare, and probably they should take time. It's a long process and it's a lot of actors involved. So it's nothing we can do just by that. It takes its time. The advice I can see we could give from the Swedish experience to NHS today is that you won't get the effects until after a couple of years. And honestly, you don't really know what the effects will be. Probably they will be better than today. That's what we see all the time, that things is getting better. But on the other hand, it's all the things around that also change the environment where we are working. Like I said in my speech today, the boundaries of Västergötland is today down to Sydney and Barcelona. We have the amount of X-rays done by telemedicine diagnosis down there. Is they a part of our system or are they their own system? That's the tricky things to see. Where are your boundaries? And I think that's a pretty easy thing to adapt for UK. You have had your boundaries around. The special context that has been really interesting me is that I have been discussing the digitalization of pathology with a lot of the vendors that are a part of this healthcare strategy forum. Because it's, I don't know the proper English name, it's a new market, new things happening, and the great things about digitizing the pathology is that so many other things are already digitized, so we can do it better and smarter and maybe quicker than we have done with for example, radiology. Some of those contacts I have already invited to come and visit us and share their experience with us in Sweden, Västergötland. One of the great opportunities with have those discussions in a forum is when you use the word strategy. Because for me, strategy in a way means that you try to convince as many people as possible about the possible future, and you minimize the risk that another future will appear. So the good thing to talk about strategy that you can always say after 10 years, how could we know? It's important for us to understand that if we don't have a strategy, we really don't looking forward. And to have a strategy, you have to look backwards. So I use sometimes to say, if you don't looking forward or you don't looking back, you should look up.